Hi everybody, Dr. James Morgan back with you here today for the health of it. Today's topic is going to be concussions. Now, as being an athlete for most of my life, it's something that I'm very familiar with. As a matter of fact, I've had 2 concussions that I'm aware of anyway. So first let me tell you, what is a concussion? Basically, a concussion in its purest form is a traumatic brain injury. Now, let me tell you a little bit about the brain. Your brain itself is surrounded by cerebral spinal fluid, and it goes, now that CSF, cerebral spinal fluid, goes around your brain and down your spinal column, acts as a cushion or a shock absorber, among other things. Now, due to the tight quarters in your head, because of your skull, which is a good thing, if there's a sudden acceleration or deceleration of the head, that can cause a jarring motion or shaking of the brain against the skull. That is what, purest form, is what a concussion is. So, how does it occur? It occurs due to a direct blow to the head or a blow to any part of the body that causes a rapid movement of the head. Now, typically we always think that concussions occur in athletics, and that's probably a majority of the time. But you also have to remember about things like accidental falls, motor vehicle accidents, among other things that can actually cause a concussion. Now, it doesn't always have to be a big blow to the head that causes a concussion. So basically, like I said, anything that causes a rapid head movement can result in a concussion. Oh, now let me tell you about the symptoms. Now, symptoms of a concussion can go many ways. Physically, you can get headaches, nausea, an off-balance feeling, and if it's a real bad concussion, a lot of times at the occurrence of it, you can see the typical stars that you might see in a cartoon. Cognitively, there's a difference in concentration or memory. Emotionally, you might actually be more irritable or sad, or different changes of emotion. And basically changes in your daily activity, from sleep disturbances to changes in appetite. A lot of times it's a decrease in appetite or your energy as well. Okay. So what to do if you think that you have a concussion, or if you're around people that you think might have a concussion? First of all, if it's in athletics, get them out of the game. The old school mentality is shake the cobwebs out, get back in there. But with all the research and the studies now around concussions, it's been shown that all it's going to do is give long-term effects. It's not worth the immediate potential gains that may be in a game, for example. And part of that too is because the frontal lobe of the brain has been studied to show that it's still developing up until the age of 25. So that's actually very important for our high school and collegiate athletes out there. So it's been estimated that about 53% of all high school athletes at some point has had a concussion prior to getting to high school. And it's been estimated that 36% of all collegiate athletes have had multiple concussions in the past. We also ask that you get medically checked out, whether that be from someone on the sidelines, if they're a medical professional, or if it's after a motor vehicle accident or after a fall or something like that. It's important to get checked out. Now, if we find that it's necessary to get a CT scan or MRI, or if it's really bad, even a PET scan, those are the things that we might want to take a look to see if there's been any damage to the brain, and it's something that we can definitely find out relatively quickly, especially if it's a shearing motion to the brain that can cause any type of bleeding. So we can also do some neuro testing as well. One question that I get a lot of times is, why is the advice to not fall asleep after a concussion? Well, it's not necessarily don't fall asleep. The advice should really be have someone wake you up in certain progressive intervals throughout the night. Every 30 minutes for a couple of hours, every hour for a couple of hours, every 2 hours, and then so forth. And the reason for that is because we can't see if there's any neurological changes when you're asleep. Now, those neurological changes can actually be life-threatening. So some of the questions that we tell the people that's going to wake up the patient really is to ask them orientation type questions. What's your name? Talk about a recent event, what their location is, or even who the president is. You also want to ask about nausea. When you wake up, hey, how do you feel? Do you feel sick to your stomach? Any headaches, any nausea, things like that, because that will tell you if there's a potential life-threatening neurological changes. Of course, if you do get a concussion, like I said, make sure you get checked out and take the advice of the medical professional that you see. So ladies and gentlemen, that is it for today for the Health Fit. Make sure you sign up for the mailing list if you haven't already, and we'll see you next week.